Now I have the very great pleasure of introducing Dallas County Judge Clay Jenkins, who probably needs no introduction, especially in this room. You all know that after taking office in 2011, he quickly became a very strong voice for the county. He does so much and believes strongly that, of course, county business should be both productive and not acrimonious, which is something the world needs much more of today. He's been a very passionate advocate for expanded health coverage in Dallas County for children and adults, and a very passionate advocate for children. He was one of the very first, and I will be forever indebted to him for this, who was willing to speak up and offer shelter to children crossing the border alone. As he said, in Texas, we do not turn our back on children. We are so honored to have him joining us today. Please join me in welcoming Judge Clay Jenkins.
Good morning, everyone. I'm so glad to be here with y'all. I look out on this room, I see so many heroes for children. I want to thank all of you for being here. I want to thank you for the work that you're already doing for our children. You know, is there anybody in this room, and you don't have to raise your hand if you don't want to, who didn't hear from their mom when they were a kid that if they worked hard and played by the rules, they could get ahead in life, or they could be anything that they wanted to be? But what this report shows, it's something I already know. It's something that most of us in this room live every day. It's that too many people in Dallas County work full-time, but they don't make enough money to pay for life's necessities, including health care, and they're not able to pass on that sense of optimism to their children. I think one of the most meaningful things to me in really understanding this, because sometimes we forget as we get older what people are going through, even if we went through it ourselves as children. We decided that we would pay a living wage to every person that worked at Parkland Hospital, and that's a county hospital. So I went out for the press conference because they wanted me to come out for the press conference. It was me and two ladies who worked at Parkland Hospital on janitorial services. And I gave my talking points like I do. And as you know, I am passionate about people having a chance to get ahead and having a chance to pay for life's necessities for their children. But I listened as this woman spoke, and the reporter asked her, well, what will you do now that you're making $10.25 an hour as opposed to, I think she was making $8.10 before that. She said, I think I'll quit one of my other two jobs and spend more time with my three children. That is the plight of the working poor in this county. I want to talk to you about the three things that you're going to talk about today. I want to talk to you about health care. We have here and I see so many of you who are already in there, but we have here in North Texas what President Obama, and I don't want to get political with anybody because I know we got a few Republicans in the room, but what the president calls one of the original and one of the most effective enrollment groups. We started this working on enrolling people in the Affordable Care Act in 2010. Actually, we started on this a little bit before there was an Affordable Care Act, getting people together and finding out who could do what. And if you're, and that group is called Enroll North Texas Affordable Care Act Coalition. It's expanded. My office leads that group. The city of Dallas is a part of it. All the hospitals are a part of it. A lot of schools are a part of it. All the insurance companies, many of your churches and denominations and mosques are a part of it. But that group works on not only enrolling people in insurance, but it also works on enrolling kids in CHIP and finding charitable partners for people. And so that's something that is, I'm going to give y'all some low-hanging fruit to be thinking about. That's something that if you're not a part of and you're not aware of, either contact my office or contact the city of Dallas and get aware of that, and make sure that every person that comes into your facilities, for those of you who are charitable partners who see people, those of you who are faith partners who have parishioners, have access to information about healthcare. Let me tell you why that's important. We've been very intentional on healthcare in Southeast Dallas, and very intentional on healthcare for the last 5 years on African Americans. We got a VISTA grant to enroll people in healthcare. One of the numbers that I like, there's a lot of numbers that are kind of sad. None of them are particularly surprising, but one of the numbers that I like is African American children, and we're seeing this with adults. African American children went from the beginning of this to being 12% uninsured to being 7% uninsured. As I said, we focused on an area that was predominantly African American. We did not focus on areas that were predominantly Anglo. Anglo children only went from 10% uninsured to 9% uninsured. I think I'll ask for a VISTA grant to focus on areas where there's a lot of poor Anglo children as well. But these are things that we can do if we work together. We've all got to collaborate. One of the simple things that can be done is, and if you know, you can contact my office on this. We'll find the person that can do this in your area, or we'll do it for you. You can put booklets out in your charity to tell everyone in your area, if you're in Southeast Dallas or Northwest Dallas or Collin County, wherever you are, every health resource that's available to them. I want to switch over to education, which education and healthcare. Well, before we do that, one other thing that we're seeing in health in Dallas that is just, it's almost intractable, is the lack of food security. You're going to talk about that some. There are different things, different needs that we have. There's a large group of us working on grocery stores, trying to get grocery stores to areas where there are not currently grocery stores. What I'm told, because I meet at the CEO level with people that own grocery store chains, is they're looking for basket rings. They're looking for that family that also buys an orchid when they buy their groceries, that also buys the box set platinum edition of Garth Brooks's 6 CDs, right? Because it doesn't cost a whole lot to print 6 CDs, but you make big money on that, and there's not much margin on milk. And so it makes it a challenge. But we've looked around the country, and you're going to talk about that someday. I'll tell you one program I kind of like that Children at Risk is pushing for here, and that's the Healthy Corner Store Initiative. So, you know, if anybody's aware, familiar with that, think about that. Think about ways where we can get healthy food. And that's just one. There are many. But think about ways where we can get healthy food for moms to feed their kids who are working 2 jobs and coming back to neighborhoods where the choices for a fast meal are going to a convenience store and getting whatever's on the shelf. That's an important part of health too. Here's a low-hanging fruit thing for you on education. On education goes hand in hand with all this. One of the best ways to get healthy food for children, here's one of the best things. I see some DISD former board members. One of the best things you guys ever did is you said, hey, we're going to have free lunch for everybody. We're going to take the stigma. If you've ever been a kid who's been on free lunch and have that little card, man, that sucks. I mean, excuse me, but when you're a kid and you have that card, that stigma, that's a tough thing. So I really appreciate what you did in doing that. And the breakfast programs and the summer feeding programs, those are incredibly impactful, important programs. A low-hanging fruit thing you can do here in Dallas and probably in other places as well is just vote. Educate yourself on these school board races pick a candidate or candidates and support them. And when you're supporting them, and I don't care who it is. Now, I'll tell you how important I think this is. We were talking about this. Ron Kirk, Mayor Rawlings, myself, we did not support local candidates in the partisan elections that just happened. Okay? We are supporting candidates in the school board elections, but I don't care if you support the same candidates that we're supporting. I think we're all supporting the same candidates. We may not be, but I don't care. What I care about is that you support somebody, and when you support that somebody, you tell them what's important to you. You tell them it's important that kids go to bed, wake up in the morning, and when they come to school, they have enough food in their stomach so that they can pay attention to what's going on at school. You tell them that you want kids to be safe. You tell them that pre-K is important, that kids need to start school on an even footing, that we need to do more in pre-K. We need to get more kids into school, into the pre-K slots we have, and we need to create more pre-K slots. You tell them to break down all the barriers with all the different people and have more early college high schools, and to not do it slowly, but to do it quickly, because too many of our kids are getting to college not college ready, and too many of our kids are dropping out of school because they don't see any future in school. And here's the last low-hanging fruit thing that I will tell you, and that is financial security. I spoke yesterday to a large church group, and what I said to the church group is, it's great, I appreciate you having me here, it's great, but I want you to go back and talk to your bookkeepers. And if the person who is cutting your grass isn't making a living wage, if the person who is dumping your trash isn't making a living wage, don't worry about all the other things I'm talking to you about today. Start off at your house of worship, making sure people make a living wage. We've got to do that. If cities and counties and churches and charities can't pay a living wage, it's like talking to your children about the dangers of alcohol while you're drinking your fourth beer of the afternoon. I mean, it just rings hollow and it doesn't work. Last thing I want to say to you is, some of you have heard, some of the healthcare people have heard, one of the passions that I have for healthcare. I watched my dad die in front of me, or have a heart attack. He went to the hospital to die, but have a fatal heart attack in front of me in a park in Oak Cliff as a little boy. And so that makes you passionate about healthcare. My life was difficult. You probably got a little sense of that. After my dad died, and my mom, worked 2 jobs, and so it was, it was rough. But then we overcame that, and life is good. And so you could look at that and you could talk about this, bootstrap Texas mentality thing. But here's the thing that you need to understand. My journey, there's a song in church that you don't know my story, you don't know my song. I guess elected officials, you learn a little bit about our story and our song. But everyone's journey is different. It is different, and these numbers show it's different. To be a black woman, to be a Hispanic woman, as opposed to being a white woman. We don't like to talk about race and equity in Dallas County or anywhere in this country, but we got to understand this. The challenges are different in different neighborhoods. One of the things that helped me growing up is my family eventually moved back to Waxahachie, where my mom was from. And in Waxahachie, there's one high school, and everybody goes together, and I got to go to school with the children of everyone, right? Our children are so segregated now. We're more segregated now than we were before busing. And we're not just segregated by race, we're segregated by socioeconomic status, we're segregated by poverty. So the neighborhood, I don't know what would happen to me if I grew up in the challenges that I see some of the kids in this county grow up in. But I do know this, and I know you all know this, and I'll just say this one thing, and sit down. When I was growing up and my mom was working, I used to stay with my great grandmother. My great grandmother liked to watch a lot of TV, and because she had diabetes, she didn't have any health care, but she had diabetes, and she went to a clinic for that. She couldn't get around a whole lot, and I guess when you have diabetes and you're sick and you're poor, that helps you get close to God, right? So she watched a guy named Robert Schuller on TV. He was a televangelist. We watched a lot of Oral Roberts. We watched Rex Hubbard. Then we watched Robert Schuller, and thank God that was the end of it because I was ready for some cartoons by then, right? But this guy, Robert Schuller, said something when I was a kid that I remember, and the thing was this. He said, any person can count the seeds in an apple, but only God can count the apples in one seed. Now, whether you believe in God or not, think about that. Now, and obviously, people know about my faith, but think about that. The potential in that apple. Only God can count the apples in one seed. We don't know what the potential of these children are, but we can all agree that they deserve the opportunity to reach that potential. And if we all work together, we can transform Dallas County. It's not just a pipe dream. We can do this. We can make sure that every child has the opportunity to live in a successful neighborhood, to go to a successful school, to have access to health care. If we all work together, we can do that. And I know you believe that or you wouldn't be here. And so thank you for being here. Thank you for spending your time here. I'm going to stay with you a little bit to hear some of your ideas. But God bless y'all, and thank you.